Kenya's north is a desert country, patched with broken volcanic ancient blackened lava flows and endless thorn trees stretch from horizon to horizon. The gigantic Jet Sea is engulfed by a massive 500-foot wall of jet black lava. The rugged landscape provides an adequate descriptive reality of the bleak hilltop and raw beauty. The history of humanity is written upon the soil of this land, the cradle of mankind, as the native call it. The fossil-rich prehistorical sites discovered by renowned archaeologist Dr. Richard Leake place the origin of the early man here. Skeleton of a Homo erectus, namely the Turkana boy, dates about 1.5 million years old. Other than its unique geological features, the Turkana region is culturally rich. Turkana culture still holds to the African traditional ways. Health is viewed as not just the proper functioning of bodily organs, but mental, physical, spiritual, and emotional stability of oneself, family members, and community. In this land, every phase of humanity transition is cemented with series of rituals.
The entire life and times of a Turkana person, they are dictated and directed by culture. From the time when you are born, there are rituals that are performed to usher you and welcome you to this new world. A goat is slaughtered and a ceremony called lokoit is performed. In other parts of the world, that is called birthday. But we call neighbors, we call relatives, we call friends to celebrate the coming in of a new person. So you can see there is already an aspect of people coming together to perform a ritual, and there is a goat that is killed. As you transition through the aspects of life, the first thing that you do as you learn, you get exposed to your animals. And for the fisher folk, you get exposed to the lake. For the agricultural pastoralists, you get exposed to land and the animals who are there, because most of them are agri-pastoralists. And
the rituals extend to transition to adulthood.
When you have passed your teenhood, that is at the adolescent stage, when you are being initiated, a ceremony called Asapan is performed. Asapan is to welcome you to adulthood, and that is pivotal for everybody, for you to be ushered into a coterie of eldership. Thereafter, when you marry, an elaborate wedding ritual and ceremony is held. And when you die, the same applies. Meaning, from the beginning to the exit of a Turkana person in this world, all his issues are dictated by culture. When good rains come, when bad moments come, when you want to seek medical attention, like what is currently happening, it is all tied and intertwined in terms of cultural perspective, including even the economic and political aspects of the Turkana person. So culture, incidentally, is the engine of the Turkana lifestyle.
As a cradle of mankind, the Turkanas have exhibited rich knowledge in the field of medicine, in treatment and management of disease, using indigenous knowledge of traditional medicine. But in 1971, a dreadful disaster struck the Turkana land.
And since the Turkana aspect of life is that every day we meet at water points communally to water our animals. And when those water points get contaminated, and there's a crowd there, and we are all drinking from the same point source, then a large population becomes infected. And the transmission goes faster because of our nomadic lifestyle. I will drink here, and tomorrow I'm away 50 kilometers away with my herds. So in 1971, what we know, there was a huge cholera outbreak. And that outbreak managed to ravage a good section of the Turkana people, because most of the areas in Turkana were water stressed. So there is nowhere that we know that a disease of this nature has ever ravaged Turkana.
There are several ways traditional Africans explain or understand the cause of disease, and the diviners, midwives, and herbalists were highly respected as they had rich knowledge and skills to diagnose and cure various health conditions. Culture has become cornerstone in medical service delivery in Turkana County.
In terms of the utility of culture to issues of diseases, the health-seeking behavior of the Turkana people is slightly different from the rest of the country. And you have just alluded that the white man and his medicine came to us way later. When you want to give birth, you go to a traditional birth attendant, and there's already always someone, an elderly person in the village, who has finished her birth plans, and she's now an expert to help the young women to usher in their children to this world. At the same time, when you become sick, like the 1971 cholera that I talked about, the bark of some trees like Nipeto. Nipeto is some acacia tree. We remove the bark, we boil, and then somebody is forced to drink plenty of that water from those herbs. And as we know that the mainstay of containing cholera is rehydration. So in one way or the other, it helped. When you have other diseases, say splenomegaly, abdominal swelling, etc., there were medicine men that existed where we could go as Turkana people to seek medical remedy. The missionaries used to have incursions of medical mobile outreaches to Turkana. They were not a priority. The national government came and set up health facilities. The first point of entry, or the first area where a Turkana person will knock their door to access medical attention, is a traditional healer called Emuron. When Emuron has not performed his duties optimally and the disease exacerbates, the second line of defense becomes our medical care. And so when you're handling issues like corona, you need to understand them from this cultural point of view so that you don't get out of sync with the people. So in this regard, the culture then becomes a mainstay which dictates how these people are going to access medical attention. And therefore, the medical issues come secondary to that.
Coupled with a long history of unprecedented long list of recurring disasters such as drought and floods, the global coronavirus pandemic presents a new challenge to the county.
Turkana has been a laboratory of disasters. Anything that could go wrong, it went wrong in Turkana County for the last 300 years. The main disasters that we knew were mainly drought and flood related. They were twin sisters, La Nina and El Nino and La Nina. Rains come, and then later on drought follows. So it becomes a vicious cycle. The other thing that is rivaling those kind of disasters is cholera that would come as a result of contaminated water points.
With the love of culture at heart, the Turkanas are inseparable from their roots of origin.
But as medical people, we are not tired. We don't vilify the traditional medicine. Instead, we set up our conventional medical care, we talk to the people, and we engage on a charm offensive to show them why it is important to deliver in a health facility, why it is important when you have suspected cholera symptoms you go to a health facility as opposed to the other person. We never even stopped there. We went to the traditional healers and talked to them to act as referral agents. And some of them have been recruited as community health volunteers. And for the traditional birth attendants, we recruited them as safe motherhood promoters so that they link these populations to us so that we can be able to offer optimal quality care as envisaged in universal health care.
Dr. Lokoel says culture remains a pillar in the fight against COVID-19.
It will be misinformation to see culture as a one big homogeneous standalone thing, and therefore you either condemn it as good or you condemn it as bad. Culture is heterogeneous. It is a hodgepodge of a lot of things into one. There are some cultural practices among the Turkana that encourage spread of coronavirus. There are some cultural practices in Turkana that actually help in prevention of coronavirus. I will give you an example. Watering points where we take our animals. There is only one watering point and you have a whole herd of animals and women crowding within that watering point. You and I know that it is difficult to practice social distancing in that aspect. Our marriage ceremonies, our initiation ceremonies, our birthday ceremonies, they actually encourage the spread of coronavirus. And equally, allow me to bring to your attention our dances at night. We love to dance about our bulls because they say music is the food of the soul. It helps you to relax after a hard day under the scorching African sun. When our dancing entails that men will stand on one side shoulder to shoulder and the women will hold hands on the other side as we engage in our traditional dances. Those things, you will agree with me, because people are talking, people are dancing, people are singing, they encourage the spread of coronavirus. But there are also other practices that actually encourage prevention measures or they discourage spread of coronavirus. For example, one of the ways COVID-19 is spread is through handshake. The traditional Turkana greeting is, you stand far from me and I say, Maata, as in, are you well? Not shaking of hands, are you well? That is a good cultural practice that we need at these extraordinary times to go back to and embrace.
The vulnerability of this county to coronavirus infection puts the health department on spot in ensuring the community is healthy and protected from the COVID-19.
For those clients that will come to the hospital during the curfew hours, and also those who will be discharged during the curfew hours, we are going to give them in their books. We are going to indicate the date and the time of the night that they were discharged from the hospital, or when they brought the patient to the hospital. And then the clinician, also the patient at casualty or OPD, they will write his name down and then sign. And also there will be a rubber stamp at the casualty department from the director office, so that they can use that note in case they meet with the officers on the way.
Community awareness remains an entry point in ensuring everyone is protected from the coronavirus that has crippled most of health sectors in majority of the countries in the world.
The advocacy, communication, social mobilization component that you've mentioned. Not only have we used IEC materials, radio spots, public address systems, and used our community health volunteers to go to, individual households and disseminate this information. The awareness is more than 99%. But whether this awareness will translate into practice is a different ballgame altogether.
With a heterogeneous population, the county hosts over 200,000 refugees. Now the county health department raises fears that if the virus gets its way to the camp, then the host community won't be spared as well.
We are hosting the second largest refugee population in this country, who are from more than 15 nationalities. All of them put in one camp. There are about 200,000 of them. So in this case, this population becomes high risk in the sense that if one refugee has this disease, he will not only infect the other refugees, but the host community as well is going to get infected. And the third dimension is the daily flights and the long overhaul trucks that are coming from Mombasa and from Nairobi to bring food, because we are not purposely an agricultural county. So when you add the 3 international boundaries that have porous borders, you had the refugee population, and you had the long-distance truck drivers coming from Nairobi, Mombasa, and the flights that are coming daily from Nairobi. I thank God that His Excellency stopped any flights coming from Nairobi. Then you realize that we are high risk.
Through the health department, the county formed emergency response committee in ensuring COVID-19 is kept at bay.
In the county, we have first of all set up a county emergency response committee co-chaired by both my deputy, the deputy governor, and the county commissioner, that meets on a weekly basis to look at preparedness, our preparedness and messaging to the public and responses in the event that we get any suspected cases.
So what do we do as a county government? We have set 26 screening sites, mapping the airstrips and airports. We have people who are manning that area. We have ensured that the border of West Pokot, Trans Nzoia and Turkana, that is the Kainuk border, it is well manned, and all the other areas, 26 ports of entry, have been put with a surveillance team. And Mr. Sadat, I'll tell you that up to this morning, we had tested 210,000 people. Screened, not tested, screened. And this screening has yielded more than 57 people who are on quarantine. Not that they are positive, not that they are suspected case. They are epidemiologically linked to counties that had this disease.
With overstretched resources, the county is on track in mobilizing resources in readiness for combating the virus.
As you know, this is an emergency that just came out of sudden. We had not planned for it. We have revised our budgets, done a supplementary tool, and the county assembly has been able to provide us in excess of 600 million shillings. That is basically going to go towards health preparedness for COVID-19.
But still stands the threat of imported cases of infection of the virus as the border points remain porous.
Our strategy is to ensure that as much as possible, coronavirus will not hit Turkana. But you will recall Turkana is in a precarious state because it is a high-risk county based on the following. One, we are bordering 3 international boundaries. We have a case that has been reported in South Sudan, 200 kilometers from Lokichogio border. The population in Turkana is 60% pastoralist. They don't respect man-made boundaries. They keep cows, the cows follow grass, the pastoralist will follow the cow. And it will lead them wherever it will lead them. So if this is 240 kilometers from Lokichogio border, then we must heighten our surveillance to ensure that we secure the border of Lokichogio and sensitize the pastoralist to ensure that he knows he's been well advised against traveling anywhere near that area, and even if he does, the precautions that he can be able to take. We have our border with Uganda, which is porous, and our relatives called the Karamojong live there. This is where we get our fresh produce. We have our border with Ethiopia through Kibish and Todonya. Most of the commodities, they come through there, and those states have also reported cases.
The bigger focus and the bigger sensitive area that we should be looking at is vehicles, particularly trucks, ferrying goods from Nairobi and Mombasa, because as we've seen, That has been the very risky group to Malaba and all the way to Uganda. And we're also careful because there's a lot of road construction going on. These commodities are transported from Nairobi and Mombasa. And so that's a critical group that we want to look keenly, and protocols have been developed how to handle. And we hope that nationally in Eldoret, they can be able to put a screening point. And in fact, they have a screening point for trucks going to Malaba, but they need to put a screening point for trucks branching from Eldoret coming to Kitale all the way to Turkana and beyond.
Aside from the risks of contracting COVID-19, food insecurity is another disaster in waiting that might strike the vast semi-arid county.
Nilianza na biashara ya mulele hapa, lakini saa hii kuanzia corona inaanza biashara imeteremuka kidogo, saa hii pesa hakuna. Saa hii lori ya cabbage haijakuwa. Kama watu wanataka cabbage wanatumana huko, inakuja kwa bei kali.
Mbeleni hata magari ya cabbage ilikuwa inaleta cabbage kutoka Kitale, ilikuwa inaleta viazi. Sasa tunachukua hapa hii badala kutuma Kitale, kwa tunachukua hapa, lakini hiyo mambo yote hatupati saa hii.
A significant amount, almost 400 million, is going towards relief food, procurement of relief food that we will have contingency for distributing to a very vulnerable population, because the vulnerability here is not, from those who are losing employment, it's few, but those who will be affected by a sudden and huge increase in prices of commodities, food commodities, are many.
The 12 isolation units and 54 quarantine centers are now set and ready in handling the COVID-19 cases in case of an upsurge.
These isolation facilities, they are purposely for cases that have been confirmed, or they are what we call in epidemiology probable cases. And we have trained the healthcare workers in these isolation units. We have set out beds and monitors in these units. A case in point is Kanamkemer Sub-County Hospital. A case in point is Lorugum Sub-County Hospital. A case in point is Elelea. A case in point is, basically scattered all over, because we do not encourage movement of infected people from one sub-county to the other.
I think we're still experiencing shortage of PPE equipments. As you may know that our orders in KEMSA have not yet been honored. I believe that they are also facing the same challenges. But we have a few which we are reserving the frontline staff. We will continue sourcing.
At the moment, we have screened at around 210,646 people.
Currently, we have 3 ICU beds, we have 3 ventilators, and some few sewage pumps, feeding pumps that are going to be used in the management of patients in the ICU units.
The Kenya Red Cross Society Hospital at Kalobeyei Settlement Scheme, as well as Peace Wind Japan, International Rescue Commission, and Save the Child Kenya are the main health program partners now on the radar in providing health services to the Turkana population.
We also continue, as you can hear, awareness creation with the communities to enhance their awareness on the situation of COVID-19, that they should not only practice social distancing here at the distribution point, but also when they go back home, at the marketplaces, at the water distribution points, and everywhere where they can go and receive any assistance or any services within the community.
The county health department confirms in ensuring water sanitation and hygiene approach based on family size, and the use of community health volunteers will ensure the community is well informed about the spread and prevention of coronavirus and help in minimizing the risks of contracting the virus. For Culture Quest, I'm Levis Musumba.